I'm the lymphedema therapist here at Physio and Fitness Clinic, and this is my friend Brie. She is an exercise physiologist from the movement therapy group.
Temika, thanks. So what is lymphedema?
Well, lymphedema is unfortunately a dysfunction within your body. So you've got this thing called the lymphatic system, and when a part of that breaks down, the fluid that goes throughout your whole body can't get away from, sometimes it's your limbs, sometimes it's even your tummy or your face or your neck. And when that happens, you need somebody to come along and help you out to move that fluid away from that area, because it can become quite dangerous. Your lymph is actually moving through your body in order to pick up all those nasties that you get throughout the day and disposing of them through the lymph nodes. So it's all filtered out and beautiful.
So you told me that you're a lymphedema therapist.
Yes.
So what is lymphedema?
So lymphedema is swelling. So when your lymphatic system with all that beautiful fluid breaks down, and there's a number of reasons for that, the fluid stops flowing. So you need help in order to move it away. And as I said before, it collects all your nasties. So if those nasties aren't removed, it can cause ulcers and all sorts of things and really bad swelling within the system. So here is a picture of lymphedema. You might not realise it, but both of these pictures have lymphedema. You can tell easily with the first gentleman, and then the second one, if you look very closely at the left leg, you do actually see a little bit of swelling around the calf. Now you need somebody to pick this up early, because early intervention is the key.
So Temika, who gets lymphedema? What causes it?
Well, there's two different types of lymphedema. One is primary, which unfortunately you are born with, and it is a lifelong condition. So mum and dad have to be quite involved with massaging bumps, make sure your limbs are elevated, so they can get it early and maintain it their lives. The second is secondary lymphedema, which comes on from a cause. And there's numerous different causes. Some are related to cancer treatments. You might have heard about breast cancer, where they remove lymph nodes. This causes the arm to swell because the fluid can't get back. There's venous diseases, anything that basically prevents you from moving. So if you've got a secondary condition, then you're not moving as much, this fluid can't get back, because as we know, it relies on movement of the muscles in order to move around the body.
You've done a great job explaining what lymphedema is, but what can we do to help treat lymphedema?
Well, as a lymphedema therapist, we look at it 4 different ways. We look at skincare, exercise, which I know you're a big fan of. We look at compression garments. So we actually fit these to different people, and there's numerous different ones. They come in all sorts of funky colours. They slip on, and it's like a nice big bear hug. And it provides graded compression up the arm to help move the fluid. The other thing that I do mostly in my treatments is manual lymphatic drainage, which means I manually help the fluid move up the body.
You were mentioning before about manual lymphatic drainage and massage. So what does the role this has to play?
So what we do in manual lymphatic drainage is I use a technique that feels quite like massage, where I target the fluid and bring it up. This does something very similar. So as you can see, it starts down the bottom and provides graded pressure, like I was talking about with that sleeve. And this will help move the fluid along. So I use this in conjunction with my therapy, because I can target more fibrotic areas or harder sections of fluid, whereas this gives a nice overall effect.
Yeah. And I'm imagining it also means that the machine can work on one limb while you're working on the other if both are affected.
Yep, exactly. A bit of a time saver for us all, which is fabulous. Means I can get more done in my treatments with my clients, and they can get some better results. Yeah. The other love of my life, which is not in this room with me, is a SOZO, but I'm going to pop a picture up here of what it looks like, and that's a measuring device. It measures the fluid within your body. So if you were to say, have a friend that gets breast cancer, she would be thinking about 1 billion different things, and I can almost guarantee you none of them would have been what lymphedema is, or if she may get it. You as a friend can get her a scan. We've kept the cost very minimal in order to get as many people in before breast surgery as possible. This shows us where her fluids are at. So if she has surgery that removes lymph nodes and things, and she starts to build up that fluid, she can have another scan and we can see exactly what's going on. It means we get her the fastest treatment, we can get her the best results, because at stage 0, it can be reversed. You hit stage 1 and it's lifelong. So we want to get as many people in order to prevent this disease from hitting anybody else. I want to be out of business. I really do. And with this machine, we can actually help a lot of people. So with that in mind, it measures all the fluid in your body. It also measures your fat levels. It measures the minerals. It measures how hydrated you are. Like, the benefits for each individual are huge. You can take it to your doctor. You can take it to your breast care nurse. And you can have all of this information ready and available for them. You can tell I'm getting very passionate now because this is what I love. This is what I want everybody to be aware of. I want you to spread the word to your friends. I want you to spread the word to your friends. I'm constantly spreading the word to my friends. And hopefully, moving forward, everybody has a much better shot at avoiding lymphedema.